What is Parkinson's disease? Parkinson's disease, PD, is a progressive neurodegenerative disorder that primarily affects movement. It is the second most common neurodegenerative disorder after Alzheimer's disease. Here is a comprehensive overview of Parkinson's disease. 1. Pathology and causes. Dopamine deficiency. Parkinson's is characterized by a loss of dopamine-producing neurons in the substantia nigra region of the brain. Dopamine is a neurotransmitter essential for smooth, coordinated muscle movements. Lewy bodies. Accumulation of abnormal protein aggregates called Lewy bodies in certain brain cells is a hallmark of Parkinson's. 2. Symptoms. Motor symptoms. Tremors. Involuntary shaking of hands, fingers, or other body parts at rest. Bradykinesia, slowness of movement. Rigidity, stiffness of muscles. Postural instability, difficulty in maintaining balance and an increased risk of falls. Non-motor symptoms. Cognitive changes. Some individuals may experience cognitive impairment, including memory and attention issues. Autonomic dysfunction. Problems with blood pressure regulation, digestive issues, and urinary problems. Mood disorders, depression and anxiety are common. Sleep disturbances, including insomnia and restless leg syndrome. 3. Diagnosis. Clinical assessment, based on the patient's medical history and a thorough neurological examination. DAT scan, a nuclear medicine imaging test that can help differentiate Parkinson's from other conditions. Blood tests, to rule out other potential causes of symptoms. 4. Risk factors. Age. The risk of Parkinson's increases with age and most cases occur after the age of 60. Gender. Men are slightly more likely to develop Parkinson's than women. Genetics. While most cases are sporadic, some rare genetic mutations are associated with an increased risk. 5. Treatment. Medications. Levodopa, a precursor to dopamine, is a common medication to replenish dopamine levels. Other medications include dopamine agonists and MAO-B inhibitors. Deep brain stimulation, DBS, surgical implantation of electrodes in the brain connected to a pulse generator to help control symptoms in advanced cases. Physical and occupational therapy, exercises to improve mobility, flexibility and balance. 6. Disease progression. Stages. Parkinson's is often classified into stages, ranging from mild to severe, based on the progression of symptoms. Complications. As the disease progresses, individuals may experience complications such as difficulty swallowing, speech problems, and increased dependency on caregivers. 7. Research and future directions. Ongoing studies. Research is focused on understanding the underlying causes of Parkinson's and developing new treatment strategies. Gene therapy. Investigating the potential of gene therapy to slow or halt the progression of the disease. 8. Impact. Quality of life. Parkinson's can significantly impact the quality of life for individuals and their families. Economic burden. The disease poses economic challenges due to healthcare costs and the potential need for caregiving support. While there is currently no cure for Parkinson's disease, ongoing research is exploring new avenues for treatment and intervention. Early diagnosis and a multidisciplinary approach involving medications, therapy, and support services can help manage symptoms and improve the overall well-being of individuals with Parkinson's. Thanks for watching.
The information provided here is for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read or heard in this content. If you think you may have a medical emergency, call your doctor or emergency services immediately.